Good day, everyone. I am Christine, the moderator for this webinar. I welcome everyone to today's webinar, Medicare Application Updates 85A, 855B, 8551, 855R. I would like to introduce our presenter for today, Yesenia Servin. Yesenia Servin, CBM SM, BESC, is an expert in credentialing and provider enrollment with over 24 years of experience in the healthcare industry. I would now like to hand over the floor to the speaker. Over to you, Yesenia.
Thank you, Christine. Thank you so much. So we're going to talk about the Medicare PECOS enrollment process. No one should be doing paper process ever for Medicare. There's absolutely no reason to do that. All of it should be going through the PECOS portal. We're going to talk about how it impacts your enrollment process and your revenue cycle. We're going to look at some of the claim information and how it impacts your revenue cycle. We're going to dig into each of the enrollments. So yes, we are talking about PECOS, but you can't do anything correctly in PECOS unless you've set up everything first in your CMS Identity and Access portal. Very easy to do. You have to log in and obtain your own profile. And from that profile, then you can add an employer, you can add a connection, you can add staff. And the way that it works is the entity, same thing, healthcare organization, you as an individual are connected as a surrogate or as an employee. This is for any organization that is a third party. So if you're doing credentialing and enrollment as a third party and not directly employed by the organization, then you have to do a surrogacy connection. And so the applications that we're talking about today are the 855As, and we're specifically focused on these, the A, the B, the I, and the R. And so your 855A is for institutional providers. Your 855I is those individuals, could be physicians and non-physicians. One of your initial steps should be immediately to understand the MAC. So your 855A Medicare enrollment via PECOS. So you start with that CMS Identity and Access connection. So an institutional provider, these are all the pieces that are required. The documentation, the CLIA, if there's a CLIA included with that, the CMS 460, which is a participation form from CMS, accreditation certificates if they've gone through any adverse action. So then the 855B, right? And we already know what that is because it's any group or clinic that submits claims on a 1500 and falls under here. Clinics, groups, individual practices, solo practices, multi-specialty practices, documents that are required. Again, the bank letter or voided check, that 460, 588, IRS letter, which I mentioned the most common are the 575 and the 147, accreditation certificates, adverse actions, AODO certification. So these can be electronic, but you can also find them on the CMS website. Your 855I. So I is individual, remember, and that's individual whether they're a physician or a non-physician. They will both be using the 855I. And then required documentation. What I love about this section is that you can actually hit that plus and it expands on it. It'll give you exactly other forms that are required for your particular. PECOS will assign an enrollment ID. PECOS will assign a PAC ID, a web tracking ID. It'll, tell you again which NPI you're working in. And once you complete all the sections and you look at topic view, fast track view, it'll tell you exactly, hey, we can't submit this yet because you need to check 3 things on this application. Just more views of what it'll look like for you when you actually log in to PECOS. And then when you actually go into each section, so when you click that plus sign, when you ask it for required documentation, it'll take you right to the 460 when you click on the 460. And this is when I tell you this part doesn't make sense for individuals, but it's still part of the application because you're like, he's an individual. There's no organization that owns the individual, right? So I always click no, but I just want you to look at what it looks like. You would be uploading all those forms that we talked about, the 460, the CLIA, the 588. So documentation is the 460, the 588, the AO, the DO. More of the documentation, which we keep reviewing, is the voided check, the bank letter, the organizational chart, which you're going to create if there isn't one. There's so many easy templates for you to follow. Accreditation, certification, licenses. So one thing I really wanted you to look at this is the information I got from the CMS director in August. So the top reasons why Medicare denied enrollment, non-compliance, why they get deactivated. A big one is you've had no claims for 6 months. So here's the scary preclusion list that I'm talking about. The preclusion list will not allow this provider to serve Medicare or Medicare Advantage members, period. More info on the denials, deactivations, and revocations and preclusions list. Thank you so much for being here. Make sure you connect with me on LinkedIn. Make sure that you're always continue to grow and learn and are actively listening when everyone is trying to give you information. Right now, there's a lot happening with Medicare in the U.S., so I encourage you to continue following CMS, continue following the MACs, because there's so much happening. Thank you, everyone. We'll see you at the next session.
Thank you, Yesenia. And that concludes the session for today. Thank you everyone for participating. You may all disconnect now and have a wonderful day.